Hi, I'm Dr. Brian McKay at Core Health in Darien. I'd like to share with you a very effective technique for reducing lower back pain. It's called the Graston technique. Now, you may have heard about it. I'm going to explain how it works, what it is, and how it can help you if you got a bad lower back. Well, you may not be aware of it, but sometimes you are a little more achy after a massage, or the pain actually gets worse. What it shows you is it results in scar tissue formation, either after a trauma or over prolonged use. The tissue changes, and what happens is the fascia, which is the covering on the muscle, starts to change. It becomes denser, thicker, and has a lot of nerve intervention, and it's painful. Michael Phelps uses Graston and attributes some of his success to having these treatments done after workouts. Now, we're not all Michael Phelps, but chronic overuse, previous traumas lead to scar tissue. Scar tissue leads to restrictive motion, which will lead to pain. Now, I'd like to show you and demonstrate for you right here.
Darien, and today I want to show you an effective technique called Graston that helps eliminate adhesions that form in the fascia. Now, if I'm spitting out a lot of big words for you, I want to describe what an adhesion is. If we took a plastic bag and we put, say, a pound of hamburger meat inside. The meat is the muscle, the plastic bag is the fascia. It's nice and smooth. It will rub against other tissue, nice and smooth without friction, and again without pain, even more so. Now, when we have a dysfunctional muscle, the plastic is now more like bubble wrap, and the surface of the skin, the surface of the muscle, becomes pitted and full of edema, and this restricts the motion and causes a lot of pain. What we do is, with the technique, we come in almost like we break down these adhesions, and as we do so, new cells will grow in, especially when we combine this with some of the additional modalities we use, such as cold laser, spinal decompression, and of course chiropractic adjustment. This part here is very interesting because we use a stainless steel surgical instrument, and what we do is we put a topical lubricant onto the patient, and since he's a low back case, we're going to do that right here. And what will happen is, I'm going to come in with the tool, and the tool more or less amplifies the feel of the adhesions. Now again, the adhesions cause pain, and by treating these adhesions or releasing them from the surface of the fascia, we're able to get a lot of motion back and therefore decrease the pain as well. So it stops the restriction. The adhesions are painful, and this will stop it. This can be a slightly uncomfortable treatment, but for the most part it's very highly effective. We use it all the time here for our low back cases and for our tennis elbow cases and our plantar fasciitis cases. So it's very effective, and if you're not using it, you may want to give this a try. I'm Dr. Brian McKay at Core Health in Darien. I'd like to thank you for listening.
And watching. Well, anyhow, the Graston technique is effective. If you've ever had like an adjustment, it didn't last, well, it's probably part of the reason is that it needs to address the soft tissue component a little bit better. Now, if you'd like to try Graston out, we're going to make it real simple. Click on that red arrow, and you'll be taken to a page where you can schedule a free appointment. Try it out. If you got stubborn back pain, it's not the only thing we do. We use laser, spinal decompression, probably some of the most advanced methods out there today to alleviate your low back pain. I'm Dr. Brian McKay. I appreciate you watching, and I hope you've learned a lot. Thank you very much. I look forward to hearing from you. Thank you.